Well, California healthcare providers are bracing for potentially crippling cuts from the federal government. House Republicans are looking to trim $800 billion from the agency that oversees Medicaid. Republicans haven't said how those cuts will happen, but experts believe that at least a large chunk will have to come from Medicaid. Medicaid program provides free or reduced cost health care for 84 million Americans. That includes kids, adults with disabilities, as well as elderly people who need long-term care. Right now, the Medicaid accounts for about 20% of all health care spending in the U.S. Now, here's one example of what could be affected. The East Bay Center for Elders Independence, or CEI. Over the past 4 decades, that center has served more than 6,000 older adults by providing medical care and other types of services. CEI's goal is to keep elderly adults with health care challenges in their homes and communities for as long as possible. Right now, they have 6 locations across Alameda and Contra Costa County. So, joining me now is Maria Zamora, the CEO of CEI. We also have Michael Mancini, whose mother has been using the center's services for the last 5 years now. I'm going to talk to you both back and forth. So, Maria, I do want to start with you. So, unless you really have an older parent, you can't really understand the needs of an older parent. And most people understand how Medicaid works and the essential services, what they are. So, tell me and us what CEI provides.
Thank you, Jessica, and thank you for having us here this evening to talk about this important topic. CEI is a very comprehensive healthcare and social care services model. So how that looks is our older adults that are in our program come to our PACE centers, programs of all-inclusive care for the elderly. They're transported by our team to our centers, and within that center, there is a primary care clinic where they can visit with their physician and their nurses. There is a day center component where they can have healthy meals and participate in recreational activities and socialize to avoid that isolation that is so concerning for older adults. Yeah. There's also a rehab gym where they can interact with physical and occupational therapists. We provide in-home care. There's behavioral health services. So as you can see, we connect all of their external specialty care. We case manage that. We provide all medications. We provide durable medical equipment like walkers and wheelchairs if that's needed. So it really is a bit of a one-stop shop for older adults who need the support.
Yeah, very comprehensive, especially that isolation is such a big deal when you're an elderly person and you need to socialize to keep your mental capabilities. Michael, I want to talk to you. Tell me a little bit about your mom and how having these type of services helps your mother and helps you, because it's such a burden on the children of older adults.
Absolutely, and thank you for having me on. My mom had a brain aneurysm about 9.5 years ago, and for the first approximately 2.5 years, we did not have services from the Center for Elders Independence and the PACE program. And it was an extreme struggle for myself, for my wife, and my mom. She could not get the necessary services she needed, and she had no social interaction. We couldn't get her to doctor's appointments. We had challenges with doctors dropping her, getting her medications. I mean, it was really, really challenging just to be able to have a baseline of sanity for her with the health challenges that she has. And then when the opportunity came up for her to become a member and participant of the Center for Elders Independence and the PACE program, it literally changed her whole life. Yeah. It's a whole life program. It really, like Maria was talking about, they do. You can't even really explain the amount of things that they do, and just the assistance meant, like, anyway, go ahead.
Yeah, I totally understand, and I feel for you, Michael. You know, I'm going through the same thing with my elderly mom right now, so I understand that burden and just while you're running around trying to get things done, and it's really a lot. So, Maria, how much does your organization or your nonprofit rely on Medicaid, and what happens if you lose this funding? Is there a way to backstop that for you?
Well, we serve 1,300 older adults in PACE in the East Bay of California, and 100% of those individuals rely on Medicaid. About 70% of them rely on Medicare and Medicaid. They're otherwise known as the dually eligible, but the other 30% are Medicaid only. So every single senior that we provide services to are covered by Medicaid. And it would be we recognize that no cuts have happened at this point. However, these policy shifts that are being proposed, if they did if they did reduce Medicaid spending, it would be really detrimental to my program and many PACE organizations throughout the country serving older adults, as this is a primary funding source. Certainly, we have CEI has a foundation. We do fundraising, but it pales in comparison to the funding we receive as through Medicaid as the primary insurer for many of these people.
All right, I want to give Michael the last word here. Michael, very quickly, what kind of an impact would this have on you and your family and your mother if she were to lose some of these Medicaid services?
I really can't imagine life without the services from the Center for Elder Independence and Medicaid. I don't think that we can manage and take care of her needs.
Yeah, I totally understand. My heart goes out to you, and thank you for the good work that you're doing as well, Maria. So thank you both for being with us and clarifying the situation. We appreciate it.
Thank you.
Okay. Well,